Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin, where you ask questions about how to become a dental student, how to become a resident, and also life after residency as a new dentist. Be sure to check out my podcast. I record and post these weekly. Hit notifications, the button that's right down here. Make sure you get notified so that you don't miss any of those weekly videos. Today, we're going to be learning a little bit more about how to become an oral surgeon. And we have Dr. Porchia James is here straight out of Dallas, Texas. How you doing, Dr. James?
I'm doing well. Thank you for having me.
Yeah, well, great. Well, we're glad we finally got a chance to get reconnected. First time we met, I had you as on the new dentist panel at the National Dental Association in Dallas. So we're kind of coming back full circle a little bit, 2 years later.
Yes. Yeah, it's been about 2 years now.
About 2 years. So, today we want to talk and reach out to those people that are thinking about or have an idea that they want to pursue the specialty within dentistry called oral maxillofacial surgery. So tell us a little bit about yourself.
All right. So first of all, I'm Dr. Porchia James. I'm an oral and maxillofacial surgeon, actually based out of Frisco, Texas, which is a suburb of Dallas. It's north of Dallas. I'm actually the owner of About Face Oral and Facial Surgery as well. You can always find me on any social media platforms at Dr. Porchia, DrPorchia. Graduated from Xavier, went to Meharry Medical College for dental school, actually went into the military and the Air Force after dental school, did an AUGD, worked, was overseas a couple of years in England and decided to apply for oral and maxillofacial surgery, got accepted, went back to Meharry and graduated 2016. And here we are today.
That's right. 3 years later. And you're doing some fantastic things. I understand you opened up your new practice not too long ago.
Yes, I opened up last spring, so we're almost at that 1 year point. Opened up the practice. At the time when I started the reconstruction of the practice, I was actually very pregnant. So when I started and we opened our doors, I think my baby was almost 2 months at that point in time when we finally opened.
Wow.
So, yeah.
So this has been a dream of yours and a journey as well, I'm sure.
Yes.
So tell us a little bit about what your thought process was when you first had some indication that you may want to become an oral surgeon, because I have a lot of mentees that are listening right now that are interested in the career, in the specialty, but may not know, how to start navigating those steps or how to put the steps together, because it's a long process.
Yes, it is. And I think for me, like I said, I did it later, which is kind of crazy to a lot of people. But when I was in dental school, I actually always wanted to be an oral surgeon. But at the time when you're kind of graduating and you're like, man, I'm done. I'm not doing anything else. And so and plus I had that commitment for the Air Force. So I had a 4-year commitment. And I said, okay, well, I'm going to see how the Air Force works for me and see what happens after that. And actually, when I was stationed in England for 2 years, they were short an oral surgeon. So at that time, I was able to do a lot of oral surgery as a general dentist. So I worked hand in hand with the oral surgeon that was there at that time, since they were short staffed. And I said, okay, I think this is something that I can do, even though it's just a small aspect of oral surgery. But as far as like extractions and sedations, and I was able to go to the OR with him as well. I said, oh yeah, this is something that I really want to do. So when I got back stateside, I applied, and it kind of worked out for me because of the background that the military for me was pretty. It kind of spearheaded me getting in because of experience.
Now, I will tell you, we have a lot of residents in my program that may not have that same pathway. And I also was in the Air Force stationed overseas. And I know when you go into the Air Force or one of the military branches for dentistry, they push you into a specialty, or they push you into an advanced training, because they, not only because they need it, but it also relates to promotion and or quote unquote tenure, or just promotional opportunities, so you can go up in rank. But sounds like your pathway was a little bit different, because that's a very unique way to get that oral surgery experience.
Yes.
In addition to being in the military, where you have some structure, and but you sound like you had a lot more exposure than probably most.
Yeah, I lucked up, honestly. I lucked up, and that's the advantage when you're in the military, especially being overseas, where, you really can't send too many things out, because their aspect of practicing dentistry, especially in the UK, was so different. So, at that point in time, a lot of the officers, or the dental officers that were on base, they tried to do a lot of advanced cases themselves.
Right. So that's interesting. So, tell us a little bit about what your typical day is like, as not only as an oral surgeon, but also an oral surgeon practice owner as well now.
Oh, my days are long. Being an oral surgeon, especially when you own a business, is so very different. And I really have to give a lot of kudos to my husband, because he's the business guy. He's the business guru. He knows all about the business side of things. So, and he helps me out. It alleviates a lot of stress for me, because I have a lot of patients to see, first of all. And a lot of times when the patients come see me, they're already extremely anxious. So it's almost like you're a psychologist to the patient, and then you have to explain what we're going to do. And I see patients during the day. I rarely get a lunch because sometimes I'm just flooded with patients. So, and then you have to write your notes and all of those things. So documenting at the end of the day, and then kind of doing like a little huddle with my husband as far as, the business side of things, insurance, and getting paid, and making sure this claim went out, make sure my note is done on a certain time so that we can get paid. So it's a lot that kind of goes into it. And then if I'm taking call, I have to think about that as well. So I'm actually these days not taking as much call as I was especially in residency, but you have to kind of just bring all of that stuff in, as far as, the patients that you're going to see.
Right. Tip for you guys that are listening that want to have your own business: you got to find somebody in the family, and recruit them into the family that's going to be your business person. That helps.
Yes, it helps alleviate a lot of stress, especially because so many owners have been embezzled. So you have to have someone that you really, really trust. So to make sure that you're getting paid, because bills have to be paid. You have staff, you have overhead. So, those things don't go away. It's a whole lot of people in your pockets.
That's true. So what about an oral surgery did you like also maybe in dental school? What was that kind of like the foundation, or was it more when you were in, I think you mentioned when you were in Air Force?
Yeah, I think it was, I always had an interest in oral surgery. Like when I was in dental, when I was at Xavier, I got to shadow an oral surgeon at the time. So, a few times a month, I was able to go to his office and see, how he did things. And when I went into dental school, I always kind of liked it, but I think I kind of shied away from it a little bit, because, I felt like people were kind of in my head about some things, talking about, well, it's hard. There aren't that many women, especially Black women, in oral and maxillofacial surgery. So it kind of hindered me, honestly, and as far as thinking about doing it.
Right.
And so I kind of let that kind of get to my head. But when I went into the military and I kind of experienced just a little bit of it, I was like, you know what? It kind of built my confidence up and said, okay, this is something that I can do. Especially when you see other women that are doing it, it definitely helps. Okay, well, if this person can do it, I know that I can do it as well.
Right. So you had some people in the Air Force, females that were also oral surgeons at the couple of the bases that you were located at?
Yeah. When I first got there, when they did have two surgeons there originally, it was one female oral surgeon. Her name was Dr. Anderson. And she had just had a baby. And I was like, oh, wow, I feel like she's like Superwoman, man. I can do that too. So, that really enhanced my confidence, honestly.
Good. Now, tell us a little bit about your application process, because we've got some listeners that are going to probably be applying right out of dental school, and I will tell you, not everyone has that opportunity to get picked up and get selected into a 4 or 6 year program in oral surgery. You have to be tops of the class, of course.
Yeah.
High rank.
Honestly, since I applied, because now, of course, you have to do the PASS application. You have to go through that process as well. You have to have your letters of recommendations. You have to have a good GPA. But now, because the boards are now on a pass-fail basis for oral and maxillofacial surgery, they now have that CBSE exam. I think it's comprehensive basic science exam.
That's right.
That you typically have to do well on. Typically, a good score is usually above 65 or so. So you have to do well on that test, because you don't have your board scores anymore. I think I may have been the last class because I started in 2012. I think I was about the last class that didn't have to do that exam. Right. But you have to do well on that basic science exam, and also your letters of recommendation. So make sure, one thing I will say this, when I taught at Meharry for right after I right after I finished oral surgery. So, and sitting on the board for our oral and maxillofacial surgery during my residency year, especially as a chief resident, I got to see the applicants. And it's one thing that I noticed was that some people, they got letters of recommendations, but their recommendations were not good. So that's one thing that I will say as far as applicants that are applying to any residency. When you are applying and you are asking for those letters of recommendation, you need to ask, do you feel confident in writing me a good letter of recommendation?
Right, a strong.
Exactly, a strong one, because you would see things like, hey, such and such is applying and they were here from this date to this date. And that's almost kind of like code for, no.
Right. Right. Yeah, that kills your application. That kills your application.
It does. So, because we look at all of that.
What are some other things that having your past experience of interviewing candidates for oral surgery, what are some other things that program directors and attendings in oral surgery look for?
So, of course, when you go to an interview, and this is kind of one thing that I tend to help people with, is knowing what to wear or how to dress for an interview. Now is not the time to have your latest fashion show, okay? You want to be simple, conservative, simple. You need to research your program, and you need to know the dynamics of the program. Are they a conservative? Are they like a conservative type of people? Are they liberal? You just need to know the environment that you're interviewing for. And it's always good to be on the conservative side. Don't come in there wearing wingtip shoes if you're a male. You got these big old pinstripe suits. Be simple. Simple is always best. Get your nice haircut, come in there professional. Body language. One thing that I saw a couple times in the interview, I remember one guy came in and he sat back like this. This is how he
interviewed. No. He's too comfortable.
You were just like.
Right. Because that gives off, you're too comfortable, you're too cocky, you just think you all that in a bag of chips and a club soda.
Exactly. Humble yourself. So body language is always, something that we're looking at. And it's okay to be confident, but if you're going to be confident, really know your stuff. Right. Another thing that I would say is know your CV. When you come in there, know your CV, because we're going to be looking at that and we're going to be asking questions. So know about, if you say that you did some research, okay, know your research. Right. Because we're going to ask that. So that is one, those are just some things that people tend to do. They know that they have to make themselves, they know that they have to make themselves look good, but your CV is going to speak for itself. So if you're coming in there fluffing your CV, it's just not going to work. I'm sorry.
Yeah, absolutely. So, knowing what you know now, as a former oral surgery applicant and chief resident, and actually being and attending within the program, knowing what you know now, what would you have done differently, maybe in your application process in preparation for it? Anything?
I think one thing about my application, I think I waited a little too late as far as preparing. The earlier that you get your past application in and get everything together, the better it is and the less stressful that you will be. So you don't want to be scrounging for recommendation letters at the last minute and things like that. So I would say to get, I would have wished that I would have gotten my application packet ready earlier, and so that I could submit my things much sooner.
Right. Okay. Yeah. One of the things that people are doing now as part of the application process as well is they are doing GPR programs. And for a lot of, we actually get a lot of candidates for GPR program that have applied to oral surgery and they didn't get in. And some of the feedback they've gotten is, well, you can't do an internship, which is the next best step, so you do a GPR program. So another reason I always emphasize for everyone, whether you're going to be becoming a general dentist or you're going to be specializing, another strong reason why you must do a residency, because we want candidates, or most of the specialties want candidates that have an advanced level of learning, but also an advanced level of experience. And depending on which school you've gone to, many residents or many potential candidates have not done a lot of extractions and have not really had to deal with compromised or complex medical histories, which is so very key. Any other advice that you would give maybe, D3, D4 dental students or even residents?
I would definitely tell them to try to do externships. If they're in school, a lot of candidates I know typically will do externships, spring break, summer, winter break, and things like that. So externships are always great, especially if you're applying right after dental school. And there are several that you can go to. I think it's on the American Student Dental Association. I think they used to have a book out with a list of all the different externships that you're able to do. And so there are several that you can do. So externships are always great. Mission trips are great to get extraction experience. I know I had gotten a lot of my extraction experience when I did this summer program. It's a clinic in Nashville called Matthew Walker. And I was able to do kind of like a summer internship, kind of clinical internship there. And I got a lot of extraction experience doing that community clinic.
Wow, that's great. Yeah, mission trips, great experience and exposure.
Yeah.
We're gonna be wrapping it up, but also I want you to talk a little bit about the fact that I know for myself, I've been having a lot of residents, a lot of female residents that are interested in the profession, and I wanted you to talk a little bit about that dynamic, because even some of the attendings that we have that are at our GPR program, I constantly hear about how they were trained, their process, which is not typical for many people who are applying to oral surgery. So could you talk a little bit about that dynamic and how you would advise those females that have this strong interest in oral surgery, but don't have necessarily the strong representation within the specialty?
Definitely reach out to other female oral surgeons and talk to them about their experience. And another thing that I will say is you have to have very tough skin. You have to have very thick skin for this, because it's almost like one of those things where only the strongest survive. And I really do mean that, because some people, there's some programs are pretty toxic. Luckily, I didn't have many bad experiences where I trained, but just by hearing stories of other females is that their goal is to get you to quit. So they want you to cry and they want you to quit.
Wow.
Because people that, just have that really old school mentality that females shouldn't be doing this. This is it's a male dominated industry, white male dominated industry, obviously. So, it's going to be very, very different experience. So you have to have very, very thick skin. The number one thing is that I can say no one can take away your knowledge. So when you're rounding, or when you're going on your rounds and things, and when you're being pimped, everybody gets pimped. That's what we call when they ask questions. That's pimping. So
oral surgery is pimping and oral surgery. What?
Of course, any specialty gonna get pimped. So you need to know. Your material. Nobody can take away knowledge from you. So the thing is, you have to study. If you know you have a mandible fracture case coming up, you need to know everything about mandible fractures, everything about the anatomy consisting with your surgery. So you have to read up on it. Residency is different. You don't have a syllabus that you have to go by.
That's right.
You have to read every day as you go. And that's how you learn.
Yeah, and I think that's key. It sounds like probably more for some of these specialties, but even for GPR program, you've got to read. You have to not just rely on the information being fed to you. You've got to do your homework. You got to do your homework on doing the homework, which is reading, studying, implementing the things that you've learned that day, and the knowledge to memory, whether you're on a rotation or whatever it is. So I think those are some really key things. And I like the notion of, maintain your knowledge. That's one thing. One thing people can't take away from you is your knowledge. And the more knowledge that you have, that you can demonstrate that you know about, I think that's appealing, whether you're male, female, or whatever.
Exactly. And it really does go to show. And plus, when you are doing your various different rotations, I think it's great to just really get fully involved in those rotations. For example, if you're going to your anesthesia rotation, get involved in it. Go early to your rotation so that you can learn about the patient. Because if you show that you are dedicated to that rotation, and you're not just looking at it like, oh, it's just a rotation, I'm never going to do this again, whatever. But if you act as if you are an anesthesiology resident, then you're going to get more cases. You're going to do more intubations. You're going to have your own solo anesthesia cases. So they're going to treat you like an anesthesiology resident if you go in there acting like one.
There you go.
Be an active participant in your rotation is the best way.
That's right. That's right. And you can't call yourself an oral surgery resident if you're not doing the things that oral surgery residents do. And that's, like you said, being active, being participatory, and giving off the notion or showing that you are an active, engaged learner in this process. Well, Dr. James, thank you so much. Congratulations again for your new office and all the training, all the time and investment, all the perseverance that you put into kind of deferring until this moment where you have your own business as an oral maxillofacial surgeon. Thank you so much for sharing your experience. How can people get in contact with you if they have further questions?
You can, like I said, you can contact me on social media at Dr. Porchia, DrPorchia, or you can also email me at Dr. James, that's drjames, at aboutfacesurgery.com.
Right, and we're going to put those links right up here, you guys, for her email address, and then also her website right here, About Face in Dallas, Texas. Well, Doc, again, thank you so much, and thank you for your time. You guys that spent the time listening to this and watching this, if you guys have other questions or have other topics you want to hear about, shoot me an email right here at newdentistcoach@gmail.com. Also, be sure to watch out this next video right here about getting into oral surgery, and another one right here about applying to residency. All right, Dr. James, thank you so much. I'm glad we connected, and posting on your success.
Thank you.
All right, bye.